First, I'll say you have not mentioned in introducing Raj that he is an expert on microfinance. So it goes a long way. Go ahead. You want to say?
No, you
yeah.
Answer first.
Well, one of the things that always comes to my mind when it comes to healthcare is a massive subject, needs a lot of attention, and it's not doing well globally. So efforts that we have been doing, institutions that we are building, are not addressing the way it should have addressed. There are government-financed programs, there are NGO-financed, donor agency financed, free medical outfits, and so on. And then the private sector thing, which comes out and provides that thing. So while these things go on, I wouldn't go in details about that. We are trying to find another alternative, run healthcare program, business-like way, but not for personal profit-making. Self-sustaining healthcare programs as a business without making profit. We call them social business, non-dividend company to solve human problems. So we created a series of them. As an investment project, they recover their money and they continue to expand their own money. They don't ask for money from somebody else. And this is investment money and so on. We can create social business funds to support those kind of things. One we did, for example, eye care hospital. First eye care hospital came to break-even point in 4 years, supporting everybody to deliver, to get the service. Nobody's rejected. Then we went to the second hospital, built the second hospital. It is capable of 10,000 cataract operation per year. So second one is the same capacity, beautiful building, and we came to break-even point in 3 years. So it's a self-sustaining. It doesn't have to bring money from anybody. It's cover everybody who comes to the door. And then we started the third one, now the fourth one. And 4 of them, when they continue to in a full swing, they will be returning the money which is invested. That's the social business principle. So with the returned money, we can get the 5th one, and the 6th one, and the 7th one. So you create a whole expansion series of them. So we have nursing college, I mentioned, as a social business. It's you invest and you get your money back. The institution continues to work with it. We have joint venture with Veolia for bringing nutrition so that we can address the malnutrition issue. This is a social business. We have joint venture with Veolia as a social business to bring drinking water. It's a huge, big problem in the healthcare system. So we have set up series of clinics as a social business. We bring pregnancy testing so that you are detecting early risky pregnancies through Intel Corporation joint venture by using technology, remote identification, and so on. So this is a whole series of things that you can do besides the donor support, besides the government-run programs or in the private sector.
I'll just say one thing that makes everything Dr. Yunus said even more true. The families we're trying to target to end preventable child death tend to be the poorest within their countries, even within low-income countries, and tend to essentially live in distal rural areas or in urban slums. And those families pay more for water than their middle-class counterparts. They pay more for drugs and vaccines than others in their countries. They pay more for any kind of health care, whether it's provided in a high-quality manner or whether it's a sham, and they're just paying for services that are not actually helping them get better. So I think this is a very important point, and I think part of why I'm so excited about and confident that we're going to achieve this goal is because we're going to have both significant continued donor commitments, and we're going to unlock the energy in the private sector, but particularly focused, as you have your whole life, on the poorest of the poor.
Thank you. Thank you so much. I'd like to take one more question from the audience before the administrator release. Dr. Lucica?
Nobody will miss me. So I'm Lucica Diziu from the Stop TB Partnership. Actually, I'll stand up, Professor Yunus. And I speak on behalf of partners fighting for TB. And, you know, TB is here with us for thousands of years. And, you know, there are very few champions speaking about let's finish TB. And I think we are at the age in which, or a year in which we should challenge and say we need to change the tide on TB. But we cannot do it separately. I'm a big fan of integration. And you gave great examples of methods to be used and, new technology in Bangladesh. And there is a great and bold target for changing preventable or reducing or preventable child death. We can work together and we can actually contribute to that goal, and we can use those, I would like to see your perspectives on how we can actually tackle TB without going into verticalizing the situation, but speaking more on the integration and how we can, along the line that the Minister of Canada said, address two things. One is that the society taking the advantage of each individual, but the second, taking more for each dollar invested. I think we invested a lot over the last 15 years in vertical things, triplicating, quadruplicating things. So I would like really from two smart public health, international speakers and minds, what would you see that will help us in changing the tide for TB as well?
One, just quickly take the cue from you, I missed. Health insurance is a major issue. We again tried to introduce health insurance for the poor people. It costs about $3 per person, per family, per year. And we provide all the healthcare services. With that as a social business, it's not a donation. You have to cover all the costs, and we do that. So this is one. Another one is the technology. The future of health service is the technology, and bring the technology with the mobile phone. All the diagnostic services could be provided at home. Nobody has to come to any place. And all the body information will be delivered to the mobile phone. So that's the focus, that's the pressure that we have to build on. While we do the expertise level, doctoral level thing, which we cannot ignore, because all this information is useful only if there is a doctor who can explain what's happening with you. So, but it can be done remotely. Bulk of it, so that all the expenses, what Raj has mentioned, just to go there and get it done, and you are ignored, you don't know where to go. Here, it directly can be done. So many of these things are happening right now, beginning, but it's a very, very initial stage. If we focus on it, many of these things can come, and we build up this relationship, how to deliver it, how to use the local girls, local boys, to bring these services to the doorsteps, so that they earn some little money, at the same time, healthcare service get done. And the healthcare service cost can be done tremendously reduced. It's unnecessarily kept high. This has to be, we have to understand that. So this is totally unnecessary. So how to push that cost down, an actual cost coming up, and that's why social business has to be promoted in that sector. Thank you.
I'll just, look, I think everything Dr. Yunus said is right, and the only thing I'll add is if you're in the halls of Congress or on television talking about this work, or designing ad campaigns and printing materials to raise awareness, just remember, you're not trying to raise awareness for a disease, you're trying to raise awareness for a vision, and that vision is ending preventable child death, ending the practice of mothers dying in childbirth, which is just no longer necessary, and through those efforts, building a basis of health that gives every child a chance to realize their potential. And so my request to you and to those watching on the webcast is just let's do a much better job every time you advocate of having the tagline be, we can save every child, save every mother, and through that vision, we can tackle each of these diseases.
So much.
Thank you.
Thank you. Thank you.